Welcome to Black Conscious Nation, The Awakening. Today we come before you with an organization called PHEN, Prostate Health Educational Network, whom Thomas Farrington is the founder. But today's interview will be with Dr. Keith Crawford. So let's get right into it. Peace. Here with Dr. Keith of Prostate Health Education Network, otherwise known as PHEN. Dr. Keith, can you take us in and explain your organization to us?
Well, PHEN is a organization that was founded by a Black prostate cancer survivor. He's a 23-year prostate cancer survivor. 24-year prostate cancer survivor. He was founded because at the time he was diagnosed, there was no information available for men diagnosed with prostate cancer. There was a tremendous amount of information when we started talking about other cancers, but there was not a lot. And there was not a lot that really targeted awareness for the African American community. From there, PHEN has been very aggressive. Matter of fact, it's the only one of advocacy organization of its kind in the world. So I can comfortably say that. And to a point where you had a Black advocacy organization that was founded in 2003 that was, up until COVID, would hold annual summits on Capitol Hill in conjunction or at the same time with Congressional Black Caucus.
You said that this was basically started by one man,
Mr. Thomas Farrington.
Mr. Thomas Farrington. And what was the purpose of him starting this organization again?
He was diagnosed with prostate cancer.
Wow.
His father had prostate cancer and died from prostate cancer. And then a couple of months after his father died, he was diagnosed with prostate cancer. And at the time, there was not a lot of information about prostate cancer. And so what's interesting about his journey is that the day before surgery, he changed his mind and decided to go into a clinical trial, not in Massachusetts, but in Atlanta, that involved using radiation and then radioactive pellets placed inside the prostate.
What I'm understanding what you said, there are different treatments for prostate cancer. My father, who had prostate cancer, he decided to go through radiation.
Right.
And that was a lot of treatments. And it was scary to him. It was scary to us as the children. But he did it. He made a decision. He went through it. And he's doing well today. But are there any other...
You're talking about different treatments that are available?
Yes, sir.
Oh, well, I mean, the treatments are going to be based upon your stage of diagnosis. What we can say that there's a lot of treatments, a lot of combinations of treatments that are available, but we have a lot of tools in the tool chest. Because if you're initially diagnosed and if it's localized, there's a treatment. If you are diagnosed with advanced disease where the cancer has traveled outside the prostate, then there's other treatments that are available. But no matter how you look at it, one, if you detect it early, there's treatments. Even if you have stage 4 disease, there are treatments that are available. And when stage 4 disease is not a death sentence. And there are people who were diagnosed with stage 4 disease who took the conventional treatment, then started participating in clinical trials that are 15 years out. What's important, and this is what I want people to recognize, is we're moving away from how we treated people in the 20th century to how we treat people in the 21st century. And in 2024, you don't need to start out with a digital rectal exam. It's just a blood test. And I'll say it again, it's just a blood test. And what you want to do is you want to start screening not at 50, not at 60, not at 69, but at age 40. Black men are at high risk for developing prostate cancer. Prostate cancer is the leading cause of cancer in Black men. Black men are 70% higher incidence for prostate cancer than people of European ancestry. Black men die at greater than twice the rate of people of European ancestry.
Wow, that's some powerful information.
The key points here are early detection. Why is early detection important? Because if you're diagnosed early, your life expectancy is greater than 98% in 10 years.
Wow.
But I can let you know that those members of PHEN who were diagnosed early are living full lives, 20, 21 years. The founder of PHEN
Wow.
is a 24-year prostate cancer survivor.
And that's because early detection.
Early detection and participating in clinical trials.
Okay. What about Black men who fear getting checked on an annual basis because they see it in the bloodline and they may be fearing that it may hit them sooner or later, so they rather not go get checked?
We have to acknowledge the fact that everyone is afraid. Okay. And there's fear without information, and there's fear with information. Once you are aware and you're knowledgeable, you can still be afraid, but you have the information that helps guide you along your journey. The problem is to be afraid with no information.
Wow. And that's an important statement there. You know, and again, to the Black diaspora males and to our women, it's important you find some way to encourage your husband, your sons, your nephews to have an annual prostate exam. In what you said, it was by blood, right?
Well, I mean, yes, it's a blood test. It's a simple blood test that we're looking for.
Yes.
With simple blood tests starting at age 40, you need to talk to your doctor about it. Tell the doctor you noted to be at high risk for prostate cancer. And if you have a family history of prostate cancer, you need to really press on the doc.
So that's the important thing is information, use it. And I like what you said, talk to your doctor about it and press on it. Because sometimes they may not see what you see, or I think sometimes we may not give the doctor the correct information that for them to come in agreement that why we need this. What I mean by this is that I know my uncle has prostate cancer, but I don't want to tell the doctor our family business. Decision with me. That makes sense?
Well, it makes sense. I mean, if you had a car that had a problem with your car, you took it to the repair shop, you got to tell them all the details. What's the history of your car?
Right.
You're not going to buy a car without having a Carfax. So why would you not go to your doctor and give them all the information they need to provide you the best possible care they can give you? Because you can't gripe about it if you're not giving them the information. But the point is this: majority of Black men, majority of men are not seeing the doctor until they're 40. And so, but what you said was very important. Not only a loved one, but bringing a loved one to you, if you can, or some kind of support with you during your meetings with the doctor, are extremely important. What happens is this, and the issue about prostate cancer is prostate cancer can come back. That whole issue about you're cancer free, I said you can never say that. So that's why each month PHEN hosts on the second Wednesday a managing survivorship. So we give you information, presentations on how to manage your prostate cancer.
Wow.
And this information is good because when you're on your journey, we need to know, exercise and diet. You may have some detailed questions about erectile dysfunction and how to treat changes in your ability to have an erection. I mean, these are questions that doctors, that the patients, survivors want to know, because the objective is to survive and thrive.
Yes. The question was, will I lose my erection? Will I lose my manhood?
I said the issue is that as you get older, your manhood, your ability to have an erection declines, and you have, whether it's radiation or surgery, there may be an impact on your ability to have an erection. But the point is that there's treatment options out there. You have one, you're going to start out right out front making sure you do the appropriate Kegel exercises to help build up the muscles there. You're also going to there's drugs, therapies like Viagra. There's injectables, and then also there's the implant. And especially if you have good insurance, I mean, here's the deal: you catch the disease earlier, you got 30, 40 years of life if you're in good health and you make the changes that you need to slow up the progression of the disease. So why would you not want to be in an optimal state?
That's the question I guess we were asked, the Black diaspora. Why would we black men not want to do this in the early stages to get the jump on the game? And,
But that's the whole point.
Yeah.
That's why we want you to start screening at 40 and begin your treatment. And if your treatment, I mean, think about it. If the cancer is in a small location, if you can go in and resect the prostate, if you're 40 years old, the probability is not you're going to have any children. So why would you not go in and do your best to manage it?
Right.
And then and go from there. Because the earlier detected, the easier it is just to remove it and treat you. Especially with the new robotic surgery platforms that are out there.
Yeah. And you mentioned earlier too, because I remember I had to do the digital exam and the bloods, but now we don't have to do that anymore.
You can start. All you need to do is start out with the blood test.
Okay. All right. And if they find anything, then
they'll repeat the blood test again, and then they'll do the digital rectal exam.
Okay, great.
But if your PSA has doubled within the process of a year, that's a concern. Okay. It could be low, below the cutoff of concern, but we're talking about if it doubles. If the cutoff concern is 3, but you went from 1 to 2 in a year, that's a concern. Fear can't rule it. And remember, knowledge is your best defense against prostate cancer. And remember, along your prostate cancer journey, we have microsites, educational portals along the journey. So if you want information about early detection screening, go to PHEN, If you are diagnosed with prostate cancer, instead of going to Dr. Google and try to figure out what your treatment options, I request that you go to PHEN PATH, PHEN, PHEN, PATH, PATH.com. And you're going to get your best care if you participate in clinical trials. Clinical trials are part of your treatment options. So we curate all the actively recruiting clinical trials in the United States. So go to PHENtrials.com. Yep.
Prostate Health Education Network will be in the description below. So I will leave the website information and go on there. You can probably do some self-analysis and just check it out. And the key thing is, don't let fear rule this.
So you were you asked a question on what you can do. The doctors can provide you the therapies and the treatment options that remove the cancer, but you as the patient, you as the survivor, have a responsibility to do a couple of things. One, we know that increasing exercise, vigorous exercise, 3 days a week, helps slow the progression of disease. 2, you have to change your diet. You're going to have to move from the normal Western diet to a plant-based diet. You can move towards a Mediterranean diet, but it's best that you move towards a true plant-based diet. You want to decrease, really no processed foods, no meats, no dairy, and focus on vegetables. Get your proteins from your beans, and decrease the amount of dairy products that you use. Now, also, there's other things like smoking and drinking. And one thing that was very important, a lot of people don't recognize that blood sugar, right? Your cancers like sugar.
Oh.
They grow extremely well in sugar. So it's very important to lower your glycemic index. That's why keeping it under your glucose levels under control is very important. Talking about the breads that you eat, the cookies that you eat, anything because all that adds sugar. You look at your ketchup. Don't worry about the sugar packets. Look at the ketchup that you put on. Look at how much sugar is in ketchup.
Okay.
Ketchup does not taste good without sugar.
Yeah, it's true.
Okay.
My body don't want it, but it just tastes good, huh? Imagine that.
So there's a lot of sugar that we ingest, and we have to get in the habit of decreasing the sugar. And there are plant-based sugars that you can use. So we just have to get used
plant-based foods. Elaborate on that.
Well, I mean, what we're talking about is those foods like kale, collard greens, broccoli, um, the green vegetable,
But
green leafy
collard greens
vegetables.
without no ham hock, y'all.
Oh yeah, yeah. I'm just like that. No, but you can do the other things that'll give it seasoning.
Yeah.
Okay. But the point is it's just that the processed meats, the meats are out, the dairy is out.
Yeah.
You do have to worry about, you may have supplement calcium intake with calcium, but the point is that you're going to have to exercise and you're going to have to change your diet. At a minimum, bring it to a Mediterranean diet. I incorporate maybe salmon twice a month, so I'm kind of like a flexitarian. You know, I adhere to the plant-based green vegetable foods, and then I may have some protein, salmon once or twice a month. Okay.
All right.
Okay.
So before we get to the closing remarks, what is the urgency you like for Black men to hear right now from you?
Well, Black men are dying. That's the urgency, and we don't have to die. Prostate cancer, there's a lot of options out there. Let me backtrack. We know it's the leading cause of cancer in Black men, and the second leading cause of death. Black men are going to have to manage this themselves. We can't be dependent on loved ones, but we're going to be the first ones. We're going to be monitoring their PSAs beginning at age 40. That's what we want people to do. At least begin the discussion at age 40 and know that we're at high risk and there are tools that are out there.
Yeah. So that was to the point, wasn't it? Black men are dying, and we can halt that by being educated and use the education and act on it.
Right.
So what would your closing remarks be for the Black diaspora, Black men and the Black women?
I mean, as we end Prostate Cancer Awareness Month, the month of September, we'll enter Breast Cancer Awareness Month. And what we want to know is that breast and prostate cancer are increasing in the Black community. And the most important thing to walk away with is early detection screening.
Dr. Keith, I really appreciate this time with you. Right. From Black Conscious Nation, we bid you well.
All right. Thank you very much.
Shalom.